Hello, and welcome to this video abstract of a qualitative scoping review of massage and massage therapy on the mental health and well-being of individuals living with a serious and potentially life-limiting physical illness by Dr. Sarah Fogarty, Ronna Moore, and Cal Cates. I'm Cal Cates. If you've worked with someone who's seriously ill, you already know something the research world has been slow to interrogate. Massage and massage therapy do things for people that don't show up on a pain scale. Most of the research on massage and serious illness focuses on metrics like pain, anxiety, nausea, fatigue. These are useful numbers, but they don't capture what people tell us. That they feel like a person again for an hour, or that they finally exhaled when they didn't think they could. So we asked a different question. What does the qualitative research tell us about massage therapy's impact on mental health and well-being for people living with serious, potentially life-limiting illness? This was a scoping review. We searched 8 databases, screened over 2,500 studies, and landed on 16 qualitative and mixed methods papers from 8 countries, which included 606 people. Most had cancer, but the review also included a variety of other serious illnesses, including Parkinson's, stroke, and children in pediatric hospice care. We weren't measuring outcomes ourselves. We were mapping what patients said massage did for them. Here's the first finding that possibly matters most. Every single paper, all 16, mentioned psychological benefit. Not most, all. That's a remarkably consistent signal for a body of qualitative research pulled from 8 different countries and a range of illnesses. We landed on 6 themes, and I want to name all 6 and then spend a moment on 3 that we think matter most to how massage therapists talk and think about our own work. The 6 themes: massage as a transcendent experience, existential respite, preservation of dignity, increased inner resources, an experience that resulted in individualized vocabulary of well-being and relaxation, and impact on physical symptoms. We want to highlight 3 of these themes because they describe things massage therapists know and see, but which are rarely studied or explored. Preservation of dignity. Serious illness strips away privacy and independence fast. Patients described the experience of massage as fundamentally different from other medical interactions. One said the hospital bed started to feel more like home. Another said it mattered that someone touched them without her having to ask. That's dignity, delivered through a unique relationship with touch and listening. Increased inner resources. Patients used massage as something they could reach for, like a tool in their own kit for carrying the weight of serious illness. One woman said, "I feel like a new woman. I felt strengthened in some way." That's a felt sense of internal power showing up for someone who is objectively frail. The third theme we want to highlight is connection, part of what we called existential respite. For some patients, their time receiving massage therapy became the best part of their week, not just for the touch, but for the relationship. One patient described the connection with her therapist as what let her flow right into the massage. That's more than a nice to have. That's therapeutic relationship doing real clinical work. Here's the connection that gets us excited about these findings. Healthcare keeps talking about patient-centered care and whole person care, about listening to what patients truly want and need. Delivering on this promise means prioritizing things that can't always be measured neatly. The human experience can't be reduced to numbers. Our review suggests massage therapy may be a direct and specific tool to deliver patient-centered, whole-person care, and may have been quietly doing that all along. We just haven't focused research designs built to show it. Quantitative research remains the majority of what gets published about our field, and it's genuinely useful. And pain and anxiety scores can't capture dignity or feeling like a whole person again. If our field only measures what's easy to measure, we'll keep underselling what we actually do and the real impact it has on the human experience. Whether you're in a clinic, a hospice, or chemo infusion suite, the next time someone you're working with describes what a session did for them in language that doesn't fit neatly into "pain went from a 7 to a 4, that's data. And it's exactly the kind of qualitative data our field needs more of to finally document in patients' own words what you already know happens in your relationship with the people in your care. Thank you. And we'd love to talk more at the poster or reach out to us at the address on the screen.